I think we will get started, and obviously as people come in, I will admit them or welcome everybody to this webinar, a third in our series for the Centre for Policy Research on Men and Boys, where we invite leading academics to share their thoughts, their research, their new ideas with us. And I'm very much delighted to welcome Anna Tarrant to the hot seat, so to speak. We will be sharing Anna's slides, and this video recording will go up on our YouTube channel as well next week. Welcome, Anna. Anna is a professor of sociology and founder of the Centre for Innovation in Fatherhood and Family Research at the University of Lincoln. She's also a UK Research and Innovation Future Leaders Fellow and has been funded via this prestigious scheme since January 2020. As many of you will know, she's a world leader in the world in research on young fathers and fathers in low-income contexts, and has held the role of Chair of Trustees for the North East Young Dads and Lads. Today, Anna will talk about her latest research on co-creating father-inclusive societies with and for fathers and their families. And without revealing too much more, and as I say, to confirm the slides will be available afterwards, I'm going to hand over to Anna, who's going to talk for about 40 minutes, I think, something like that. And then there'll be time for a few questions afterwards. So, Anna, over to you.
Brilliant. Thank you so much, Nick. I will just share my slides, and sound is shared. I'm going to play a short video today, and I'm just praying that that's going to work without too much trouble. So thank you very much for inviting me today. Hopefully you can see the slides. Little hands up. You can see those okay? Lovely. A huge thank you to you and to Mark for giving me the opportunity to share some research that and my research history really, which has been a passion of mine for a very, very, very long time. A lot of my work is very applied. So as much as I'm very interested in going out and researching with different communities, and as is the case with my work with men as fathers and male caregivers, increasingly my work has also become much more about how we bridge the relationship between research, practice and policy for the purposes of transformation and social change. And I'm going to take you on a bit of that journey today. It's impossible to do justice, I think, to sort of over 10 years or 15 years of research, at risk of aging myself there, in the space of 40 minutes. But I'll give you a bit of a whistle-stop tour, and I'm really happy to take any questions and comments after the seminar today. So just to set the context really, and a lot of this will be incredibly familiar to those of you who have joined us today, but we know that concerns and questions around the problem of boys and men as fathers are high on the agenda again. And I put problem in commas there because I think we can be quite critical of what we mean by problem in this regard. Programmes like Adolescence, the new Lost Boys report, the role models debate, and also the men's health strategy are all examples of how we're engaging more around what it is to be a man, what we think men's role is in society, and how we might better address support and facilitate support for men as fathers. But important part of my work is how we sort of shift away from that very individual framing of men and boys being the problem to thinking about how we actually resolve that or think through those questions at a social and societal level. So where we hear things about fatherlessness, for example, a crisis of masculinity, the lack of male role models, my question has always been, are these the true causes and solutions of the very complex social problems that are faced by boys and men, but particularly for those in low-income families? I think for me, what these debates really indicate is just a clear and continued need for further research and radical societal reform. And that's the thing that's really driven much of my work. I will just say that prior to my UKRI Future Leaders Fellow study, I was involved in another study called Beyond Male Role Models, which took place at the Open University. I think that started in 2014. And we started doing that research even then, over a decade ago, because these kinds of questions are cyclical, and they sort of capture policy and practice attention, particularly at moments of societal crisis, I would argue. And I think we're starting to see that again. So again, what my research has tried to do is actually say, well, what are men's experiences? How are men experiencing these different debates and discussions? What are the actual problems they're facing and experiencing? And again, how might we do things differently to address those and support them in a more progressive direction? So I have been researching marginalised fathers for a long time. I've published several books on this area of research. In 2021, I published a book called Fathering and Poverty, and that was all about uncovering men's participation in low-income family life. I was really struck by these broader policy debates about kind of men in low-income circumstances or men in crisis, how readily men in those contexts were assumed to be absent, were assumed to be uninterested in their children, failed as breadwinners, and the deficit narratives really that surrounded them. But when I went out and searched for some of the evidence, when I was sort of looking at research, and what I found was that we don't really interview them, we don't really engage with them, and we don't understand their lived experiences or don't give them the voice that they might want they might have in terms of talking about their family relationships and their care responsibility. So Fathering and Poverty was a study funded by Leverhulme Trust that sought to address that and to address the evidence gap. And I ended up researching with young fathers, so young men aged 25 and under, male kinship carers, so men who take on the care of children, grandchildren, nieces, nephews, when there's a child protection concern or where the parent generation is no longer able to provide care for those children. Single fathers, so men who were relatively unusual in context of broader trends around single parenthood, and were caring for children on their own or in their own household, and then own household fathers, so men who perhaps weren't the primary caregiver for their children, but were seeing their children when they could and according to different contact arrangements. I've long conducted qualitative longitudinal research with men in low-income families. So rather than just a snapshot view, a one-off interview to find out about their lives, what my research has done is kind of follow those men over time, to look at kind of the ebbing and flowing of their parenting journeys. And what that enables us to see is their interactions over time with different systems and with different services, and to assess the extent to which societal conditions either support or constrain men in their intentions to be involved in their children's lives. And the key finding really is that far from fatherlessness, men in low-income families really do play important but very often invisible roles in caring for and sustaining their families across generations and often in contexts of hardship. My book with Karen Hughes, Men, Families and Poverty, what we did there in that study was we looked at data that we had available in an archive called the Timescapes Archive that included some insights from men in low-income contexts but hadn't been subject to analysis. And there what we were able to see is that across this broad sweep of 20 years of beautiful depth, qualitative longitudinal data, that men were really engaging heavily, either as grandfathers, uncles, brothers. They were operating through a whole range of different familial identities that we simply just aren't paying attention to. Again, what we're able to see is generational change as well, socio-historically, socio-economically, and able to see the opportunities or constraints that creates in terms of balancing work and care. And in prioritising care, in prioritising family, what we're able to see is, or render visible, are the different ways in which men are doing family, and really speak back against some of that fatherlessness narrative. It's not to suggest that fatherlessness or absent fathers are not an empirical reality for many men. Lots of men in our research do talk about the absence of their fathers, but for a whole host of different reasons. It might be because of relationship breakdown. It might be because they've gone into prison. It can be because they've died early and young because they're living in low income, deprived contexts. But for me, it's the reasons why they're absent that's interesting, because that builds an explanatory power that shifts us away from blame-based deficit narratives towards, again, what are the conditions and the processes that are leading to that absence, and what is absenting men from family contexts in particular ways if they're no longer involved in their children's lives or particular sets of relationships. And what we've also sort of seen as well through the literature is this continued erosion of welfare support for families. And that's meant that men participate in diverse ways in their family lives at different ages, and again, often in ways that are overlooked and unsupported. What's also really apparent through this kind of intergenerational look at fathering is a real growth of the father identity and the shift towards more grassroots organising. And what we're starting to see is the shift in how we conceive of men's identities from breadwinner to caregivers, and also the transformative power of men's identities as fathers as well. And what's really encouraging, and this is something that Mark noted actually on Monday in the Westminster Forum, is that men increasingly are organising themselves around the identity of fatherhood. And that's creating a new visibility, I think, for fathers in ways that we haven't seen before. So it's just really interesting to sort of look at that in context, I think, historically, and in terms of what that means for contemporary understandings and explanations of men as fathers. The main picture, though, again, across all of this work is about how we frame and see men in their roles as fathers. And for me, it's a shift from seeing men as failed breadwinners. Again, if we look very narrowly through an economic lens, we see men as absent economically, materially, emotionally, all of those things. We don't see the emotional, the nurturing, the caregiving that men very often invest in. So I try to shift the narrative and shift the dial in how we're thinking about fathers, thinking about from breadwinners, failed breadwinners and fathers to fathers failed, again, shifting us to social conditions. So that's a bit of sort of history of kind of where my thinking has evolved through, really. And again, it's always evolved through depth engagement with evidence that we have and new evidence that we've created. The Following in Fathers Further study, which is what I'm going to focus on mostly today, built out of all of that history of work, essentially. So the Fathering in Poverty study included a sample of young fathers and brought me into a new set of relationships with researchers based at the University of Leeds, who around 2010 to 2015 were conducting the first ever study of young fatherhood, and this was called Following Young Fathers. Following Young Fathers was actually first established in response to engagement with professionals at a teenage pregnancy strategy forum in Leeds all the way back in 2010. The teenage pregnancy strategy had actually just come to an end. It was heralded as a success in terms of reducing teenage pregnancy rates. But Bren Neal, the PI of that study, the principal investigator of that study, she had been researching with young mothers, and she had gone along to this meeting and said, I've got this idea for a study. I'd really like to research young motherhood and think about how we can enhance the evidence base on young mothers. And professionals and practitioners at the time actually said, you know, that's really important, but we actually have quite a strong evidence base about young mums. What we don't know about is young dads. So she got some funding and identified 34 young fathers who she followed over time and looked at their parenting journeys, looked at their support needs, their support engagements. The similar kinds of questions that I was also asking, but of men of different generational positions. I did a secondary analysis of some of that study and the data that it produced, and that's what kind of got me integrated into that study. And an opportunity came up in around 2016 to apply for some impact funding from the University of Leeds, which is where I was based at the time. And what we did was we took forward relationships established with professionals also through that study, and the ones who had sort of prompted the study in the first place, to consider how we better support and think differently about young fathers. So we, over a period of a year, we co-created a dad support group, a young dad support group, and piloted that for the first time. We worked with a professional who was engaging with young fathers in prison contexts, and we looked at following those young men through their resettlement processes to consider how we might develop better pathways for fathers when they come out of the criminal justice system. And we also looked at how we could enhance training, professional training, with young fathers involved directly in the delivery of that training. Like the other research studies, this study is qualitative longitudinal and also participatory in design. So again, we followed young fathers in some cases across a 10-year period, because we were able to re-identify and re-access some of the young men who participated in the first study. I always tell this story, but one of the dads that we interviewed was 30 at the time. He had his son when he was 15, and he was saying that, you know, my son is now 15, and I can't believe that I became a father at that age. So that was it's really sort of touching and interesting. And again, he was saying, you know, he's far too young to have been a father. I was far too young to have been a father. So being able to reflect on that was really fascinating. But we sample boosted, so we identified fathers much further afield in the UK, and we started to capture fathers who were just entering parenthood from the age of 15 onwards as well. Another sort of innovative element of our study is that we sought to compare experiences of young fathers in the UK with experiences of young fathers in Sweden. So the idea of that was to enhance this kind of the evidence base and the questions we had about the extent to which welfare, family policy, and broader social systems shape and influence people's parenting journeys. And that was a really fascinating study. So what we found with that is that young fathers in the UK, we problematise that experience much more so than that occurs in Sweden. So when I went out and spoke to some of our Swedish partners, they sort of said, why young dads? And, you know, why young men under 25? That's not something that we necessarily think about. In the UK, we do think about it, and that's in part, I think, reflective of who needs support and how we shape and structure particular forms of support beyond the state and by the state for particular populations. The participatory design of our research is about the co-creation of dads groups. So moving on from the Leeds-based group that we established in the 2016-2017 study, what we sought to do was create a young dads collective, which I'll talk about in a bit more detail later on, that involves working with and for young fathers and with professionals to create interventions that they inform, that are place-based and responsive to local needs. And that's really where the innovation part of the study came from. So driving all of this is a research-based approach about what matters to fathers as a starting point for what needs to happen in practice and policy. So if we're going to create systems and services that better support men in their caregiving responsibilities and with their intentions to be there for their children, which has been core across all of the research that I've done in the last 15 years, we need to understand their perspectives and we need to respond to those as well. What we've also done through this kind of impact innovation type approach to the funding, to the study, is develop a practice-based research to research-based practice cycle. So we're seeing everybody in the system as experts by experience, and trying to bring together all of that evidence, all of those different perspectives into one place so that we can, again, respond in ways that are more progressive, and that help us to actually create interventions, create evidence bases that really speak to the needs of the people that we're interested in supporting more. So again, whistle-stop tour of this study. This started in 2020, so just before COVID hit. It's actually been funded for 7 years, so currently 6 years into this programme of research. We're publishing from the study, doing a lot of work, again, around how we sort of influence policy and practice using those findings. Now, the findings from that research, the evidence that we produced, again, really important. So this is what we learn, and this is really what matters, in our case, to young fathers. But I should just caveat that in looking at young fatherhood, our findings, I think, are relevant to fathers more generally. So fathers in general feel excluded from services and systems contexts. But if we look at some of the more marginalised and some of the more deep challenges that some of these people are facing as they navigate different welfare employment systems, again, I think we're better equipped to stop people falling through the gaps in quite the same way. And what we identify from following young fathers and the latest study is that where young fathers were previously framed as a social problem to be solved, and again, they are also subject to the ideas of fatherlessness, absent dads, all the deficit narratives that we tend to creep through at a policy level. We've found them to be engaged fathers navigating systemic challenges. So across this broad sample, what we found is that young men adhere strongly to an ethos of engaged fatherhood. This reflects a cultural generational shift towards father identities. I slightly question how new engaged fatherhood is, because if we look at social historical research, there's actually lots of really fascinating evidence about men as fathers, including in low income or working class communities. But we don't necessarily look at them through the lens of caregiving, and we focus so much on breadwinning and economic provision that, again, the caregiving that men have actually always been involved in some ways have been overlooked. We found that there were lots of unplanned conceptions. That was absolutely true of the sample. 29 of 34 young fathers that we engaged with did experience unplanned conceptions, which might align with some assumptions around, that children to young parents are, not planned for, not always kind of the result of a relationship between or existing relationship between the parents. But what we found universally and uniformly, and across all the longitudinal data we've generated, that an unplanned child does not mean an unwanted child. Yes, the young men find the adaptation process to becoming a parent incredibly challenging. It's emotionally difficult. They have to come to terms with the fact that people are not always happy that they're going to become a parent, and they report being told, you've ruined your life. You're not being celebrated for becoming a parent. But they work incredibly hard emotionally and in terms of accessing the resources they need to be a parent to make sure that that child is loved and that they're present in their children's lives. And we found that their relationships with the children's mother and maternal grandmothers were really important in terms of either their ability to be involved in their children's lives or not. So what we're still seeing is kind of gendered cultures around care responsibilities that operate within families. So there's an element of contingency for the young fathers on having positive relationships with child's mum and also maternal grandmothers. Sometimes, their investments, their involvements are necessary. Where dad might present a risk, then they become really important in terms of supporting those children. But again, what I'd argue is we lack support for men who might be a risk in family contexts. We don't have very many interventions that enable men to invest in the caregiving elements of their identities. So that creates a lot of pressures for women in families as well. We highlighted a lot of social isolation and loneliness among the young men in this sample. So as much as they become a parent for the first time, they're still young people. So the responsibilities of becoming a parent, taking on those responsibilities and working through them, very often isolated them. And this was compounded by a lack of access to support, a lack of community groups supporting men as fathers. There are some that exist nationally, but they're actually a bit of a postcode lottery. Around all of this, around the challenges of establishing and sustaining a father-child bond, young fathers were finding it difficult to secure what they need to father. So they talked about insecure education and employment trajectories, and they were some of the most disadvantaged by the housing system as well. And I'm going to show you a video in the moment of a young man who ended up going to live in a hostel for a little while, and having to be in a hostel really impacted on his ability to see his children, and again to invest in that relationship with them over time. The housing system, again, as a form of welfare, is really interesting in the UK. Lots of young men aren't asked if they're a father or if they have caregiving responsibilities. Again, they're framed as single men. And again, these are the kinds of things that subtly and sometimes very poignantly operate to absent men from their children's lives. They also described a mix of support, sidelining, and surveillance by public health and support professionals, and a quite binary sort of framing as either risk or resource. And more often or not, felt like they were being sort of treated as a risk to the family context. When we talk about sidelining, what we mean by that is that they feel relatively invisible in professional engagements. The really interesting example by a young dad that we worked with, who was talking about a social worker coming over to show them how to wash baby. And he said, I was sat on the couch, rolling my rolly, and we're just waiting for them to ask me if I wanted to be shown how to wash the baby. They both sat with their backs to me. And so while he didn't necessarily push himself forward to say, I want to know how to do that, again, just subtle practices like that made him feel like he wasn't an important parent. And actually just turning around and being asked that question would have really helped. Feelings of surveillance tend to be much more focused on those where there are child protection concerns or engagements with social workers, and of course absolutely essential in those contexts. But they often felt like they weren't seen again as somebody who was positive in the family context, regardless of whether there was evidence of that or not. If we looked across the sample, we had a very diverse sample of young fathers from very different backgrounds. What we saw particularly was really sort of difficult challenges for young dads living in poverty, and teenage pregnancy, young parenthood rates are higher in areas of deprivation, and that's still the case. So as much as nationally teenage pregnancy rates have come down, there are still pockets of high deprivation and high teenage pregnancy. So again, a lot of these young men don't have the familial housing resources that might be required to support a child. So we had lots of young men, for example, who were caring for their children in a shared bedroom with their siblings, for example. Grandparents' housing became a space where they would be looking after their children, and that led to all sorts of interesting dynamics with grandmas, with granddads, who were trying to let them sort of take responsibility and learn how to parent, but also they sort of saw that as kind of an interference as well and a bit of a challenge. Some of the young men, not many, but a few in the sample, so I think there was 3 of the 34 went into prison across the period that we were doing the interviews. And of course, criminal justice and prison systems are a physical barrier very often between fathers and their children. Some benefited from fatherhood support programs in the context of criminal justice, but very often when they went back into the community, the fatherhood identities weren't recognised or acknowledged in the ways that they were when they were in prison. So they were having to grapple again with those kinds of processes and their identities and how they were being interpreted. We had a couple who were brought up in the care system, again, for those young people, not necessarily having their own role models around parenting, quite sort of obviously fractured relationships in their past, and then trying to sort of forge their own relationships with their children. So needed some support for some of those kind of relational dynamics. And for many of these, mental health challenges and problems were also quite high and apparent as well. So they're really trying to deal with their own individual challenges while also taking on the responsibility for a new child at a young age, at a time when they're not necessarily getting the support that they need. So I'm just going to show you now a 3.5 minute long video. This is one of 4 videos that we've created from the study. The rest are on our website, Following Young Fathers Further. But this tells the story of Adam. He's one of our participants that we've been engaging with for over 10 years, as it says on the slide there. What this shows, this video, and obviously I'm really interested to hear your own interpretations, but it shows kind of some of the joys and some of the challenges of being a young man, trying to become a young man while also being a parent at the same time, and also kind of the interactions with different systems and services, what works and what doesn't. So I'm just going to play that now.
I felt a little bit scared and a little bit sad. I don't even know why I felt sad. It was mainly excitement. Like, I was jumping up and down. I'm happy. Like, the whole being a dad thing is kind of scary because I'm only 16, but it's really nice. I feel supported, but it's a bit too much. Like, especially social workers, they've got too much power because they can take away your kids. Yeah, where's me loads? Like, I'd hate it if they took my son away from me. I just couldn't cope. I couldn't get over that I've got a baby. Like, I've got responsibilities. I need to grow up. It was all at once, and it was just too much for me, man. I just had to steadily get on with it and just start learning. Like yesterday, like, I looked after him. I went to college. I finished at 3, and then I looked after him. He wouldn't stop screaming though. He just didn't go to sleep. My mum got back from work and like she took him off me. My son can't come to the hostel. I've got to be there at least 4 nights a week, so it makes me a bit upset now and then, but like, yeah, at least I get to see him on a picture. I've been spending a lot more time with him. Like, it's great to have that bond with him and like be able to take him for walks and pick him up from school and carrying him on my shoulders. Like, we go to the park on the swing and on we slide. I'm like a stay-at-home dad at the moment. Like, there's a guy, you're told from a young age that you should work and provide, and it kind of takes its toll on you when you're not doing that. He's the only person that supported me without having to gain anything from it. I mean, like, apart from my family. Yeah, he's always supported me. He did everything that he could. Like, you got to find your own way, but just to be able to speak to someone about like what was going on at the time, yeah, it's priceless.
That's just one of our videos. I'm going to move on beyond this slide in a moment, but one thing that the participatory approach and the multi-perspective approach we took really helped with is it enabled us to also understand professionals' perspectives as well, and we captured some of the challenges that they were experiencing. Before I move on to that, I just wanted to sort of demonstrate, that We know that father involvement has a range of benefits and that it's something that's really important to support. And we know that for children and in the long term, it can lead to higher self-esteem, emotional development, empathy, life satisfaction, educational achievement, and decreased risks of behaviours like criminality and substance use and abuse. And we know for women, it can support them with their mental health and broader family well-being. Balanced divisions of labour, and sort of promotion of maternal health behaviours, particularly in the sort of perinatal period and early form of parenting. And we know for men that it leads to improved well-being and life satisfaction, and also the emotional and social benefits of investing in caregiving for children. So it's a really important evidence base that this is something that young fathers really do need support for. In terms of barriers to service access, so there's evidence that professional support for fathers should be core business, but the existing literature demonstrates that, again, there's a range of different sort of constraints on professionals as well. So we need to, again, shift away from any blame-based culture as much as possible by trying to understand the systems through which professionals are also operating. And so these are just some of the things that are operating as barriers and challenges for professionals. There is challenges for men individually in terms of whether they trust services. Many of them distrust services and also fear worsening problems as well. And these are parts of the things that, or parts of the processes that can render them invisible from services. Sometimes there are elements of maternal gatekeeping. So women don't necessarily want the fathers to be involved. There are gendered ways of thinking about fathers sometimes, and sort of an acceptance of stereotypes that assume disinterest in parenting among men. At the sort of more structural level, we can see that there's limited access to training and reflective supervision for professionals, and that's something that we're trying to address through promotion of father-inclusive practice. Constraints on workload capacity have increased. Sometimes the level of need that young fathers have can be translated into deficit assumptions, which might reflect a form of unconscious bias. So again, we saw the challenges with housing and with employment and all of those things, and how hard that is for young people to do and to access. But that doesn't necessarily make them a bad father. And as I mentioned earlier, access to specialist support services is a postcode lottery. There are very, very few services, although it's encouraging to see more and more campaigns and more groups cropping up over time. So this has led me to think about father inclusion. So shifting that narrative, shifting from the problem of men and boys to systems and services that are father inclusive. This is an empirically driven agenda. So this comes from the language of professionals that we've been interviewing and researching with over time. And it's about creating systems that meet men where they are. And I think that fatherhood is one way in which we can do this. Again, we know that there's an extensive evidence base confirming father involvement has positive benefits for men, women and children. There are practice concerns about low levels of public health and service engagement with fathers, which have potential to undermine father involvement. There are dominant views, actually, that fathers are hard to reach and that they won't or can't engage. And they're reinforced by this risk-based framing of fathers across services. But one thing we can do to shift the narrative and change that dial is think about, well, how a service is actually hard to access for men. So there's all sorts of these kind of interpersonal, cultural, structural and organisational challenges going on that serve to absent men as fathers. Father inclusion is therefore a transformative agenda. So it's about promoting men's engagement as fathers in service and support settings. And these are beginning to be sort of, as I say, evidenced more and talked about more. There's actually a growing evidence base about what works in that regard. But another challenge for professionals is that it's often behind a paywall. So it's in journal articles, and you need to be able to access that through a library or a university, or it's lost, or staff move on and we lose institutional memory. So the question driving all of this is, how do we create a policy and practice ecosystem and influence it through the evidence base? part of that is about creating dialogues, it's about provision of training, and also trying to get buy-in across the service and welfare system. I use Bloomer's a sociologist, his concept of a sensitising concept, and that's all about the idea that when we include all fathers, we need multiple actors to work together to use that language and to translate that for their own practice and policy context. It's potential practice and policy framing strategy as well. So if we think about how we're father inclusive as services, if we audit our services and think about what father inclusion might look like and what it might mean, we're better equipped then to engage dads and sustain that engagement over time. I always talk about it as a bit of a sociology and politics of optimism as well. And that's not to suggest it's not achievable, and I hope it's not unachievable, but about striving for change and being proactive in doing something differently. And in 2005, I published this framework, which is all about thinking about the connections and the different sets of relationships within the system. So where father involvement and all the evidence base there is about fostering the benefits of father-child and mother-father relationships and very family-focused. Father engagement literature looks at relationships between fathers and professionals, and that can help us to build kind of towards father-friendly or inclusive service design and delivery. Father inclusion is the broader language that brings us all together, is a framing strategy, and allows us to be reflexive about what we can do differently and how we can do things more effectively. Just in terms of the what works literature, there are, again, as I say, lots of bits of evidence about what does work. We need a whole system approach, and that involves supporting father inclusion at every level, and that's at policy, commissioning, service design, frontline delivery. We need flexible funding and provision, so a blend of services across health, social care and community, so that we ensure that dads don't fall through the gaps. There's a need to design services that attract and retain dads, and I saw Paul Goldast's talk on Monday as well. He talked about the 5R framework and the importance of the retention of fathers within services and the building of relationships, and that's absolutely apparent in the fatherhood space as well. Ways we can do that is focus on the processes or the pathways that fathers go through in terms of, first of all, accessing services, engaging with them, and then keeping them involved over time. And the way we can do that is we can speak to dads directly. So we base design of services on what fathers say works, and with attention to the benefits for women and children. And we can co-create services as well, which I'll talk about again a little bit more detail, although I'm conscious of time, so I'm not going to go on too much longer. We can show dads that they're welcome, use the language of father. Parenthood is often synonymous with mother still. So talk about fathers and male caregivers in our outreach. Ask dad, are you a dad? So record the data, embed that identity very clearly through the kinds of questions that are asked. Building relationships, absolutely key, meeting dads where they're at, being curious, noticing and challenging assumptions, requiring accountability, but also, working in a way that's sensitive to the kinds of challenges fathers might have. We also know that a culture of learning and reflection is really key. So continuing professional development around father inclusion and online training, all of those things are really important. Ultimately, one thing that NEDL, North Eastern Dads and Lads, always say is about celebrating fatherhood. So not you've ruined your life and that's the end of your life, but you're a dad, that's great. What do we do next? So building on that strengths-based relational approach. So our co-creation model, the Young Dads Collective, again, is about co-creating place-based support. This is a model of co-production, again, in support with and for fathers, that involves training an audience of multi-agency professionals about what it means to be father inclusive. And the theory of change is that it works across multiple levels. So at individual development level, it supports young fathers as experts by experience, by involving them in process of co-production, helping them to build their confidence and their skills. And in the case of our Young Dads Collective North model in Leeds, several of the young dads actually went on into secure employment, having been involved in that model. It creates a space for peer support, so young men, young fathers coming together as part of a community, being able to talk through some of the challenges they're experiencing, but also to see that they're not just individual challenges, they're challenges that other young men are experiencing too. Professionals receive training from the young dads. They're encouraged to think about how to be more father inclusive. It's much more powerful when young dads do it than when I do it. It's much more persuasive. And we ask them to make pledges for practice as well. And also, this model's been really powerful for thinking about policy change. So some of the young dads have spoken at the all-party parliamentary group on fatherhood. They've attended strategy meetings in their local areas to encourage recognition and consideration of young fathers and how they might be supported and thought about at the level of service design. I'm not going to read out all of these quotes, and you'll have access to the slides after the event. But what we've done through this co-creation process is we've captured the change and the transformation from that intervention for all of the key people involved in it. So professionals here talking about that they actually asked about Dad, they asked for a follow-up on Dad and his role in the family context when they hadn't done that previously. The young dads talk about, wanting to create better experiences for other young dads. They're not, they're altruistic about these things. They want other young dads to not experience the challenges that they have. Our co-creation partner said this was really helpful because it evidenced that we're not supporting fathers enough, and even having that evidence is a strong basis for which to do things differently and to make investments in father support. And the regional policy manager at the bottom from Grimsby, our third model here, talking about that there's actually been a policy shift and a policy change regionally, and that the strategic and operational environment in Grimsby has been improved because of the visibility of that group. We've also co-created some parenting support with the North East Young Dads and Lads. I don't know how many of you are aware of DigiDad, a different form of co-creation, but with the young dads, we've created toolkits for professionals that are available for free online and have reflexive spaces in them. We've created a series for professionals of 5 videos, which talks about the key themes in the Dynamics of Young Fatherhood book. So housing, education and employment, relationships with mum and baby, relationships with professionals, and then the benefits of co-creation. So please do check those out in your own time, and do recommend those to others. What's really great is that we've worked with the young dads to script the videos. The DigiDad videos include things on mental health, on feeding baby, on 0 to 3 months of having your baby. So it's all sort of sense checked with professionals as well. And in line with the academic research. So, as accurate factually as we can make it, but also reflecting their lived experience. I do a lot of public sociology as a sociologist, so and this is one of those things. One thing we've created is the Father Inclusion Hub, which is a growing archive of examples of what works in father inclusive practice, and I'm always looking for new examples or videos or PDFs, whatever you might have, of things that you've done in your services that are father inclusive, and everything on there is free to access as well. So there's lots of lovely material in there that you can draw on and use as templates for your own practice. We were on the One Show last year with the young dads as well, and again I do a lot of talks and things for the family hubs particularly at the moment, and training through the centre to promote this work. So next steps is to keep building the Centre for Innovation in Fatherhood and Family Research, increasingly looking to influence UK and European policy as well. There's a bid in at the moment to build a network of researchers and policymakers around father inclusion. We're also looking to keep promoting, embedding and evidencing father inclusive support, and that's through evidence-based models of father inclusion like the Young Dads Collective, and I'm really keen to find new partners in which to trial that with and to implement that with. I provide consultancy and evaluation as well around father inclusion audits and those kinds of things, and also training and short courses. I've got a short course running at the end of January, which is an introduction to engaging men as fathers as well. So trying to speak back to that evidence base and to, again, think through how we do things differently. Okay, I've gone way over time. Sorry, Nick.
Not at all. That was absolutely fantastic. And